Hello, welcome to another edition of Health Talk with Motiat. Good morning, my name is Motiat. Welcome. Thank you for joining me today. I really appreciate it. I do not take it for granted. I thank you for the opportunity to teach. Greatly appreciate it. Before I get started, I normally go through a little spiel on this is I'll go through a disclaimer of this is not a form of treatment. This is just a health awareness only. This is just so you can have an awareness of what's going on in your body. So this is what this is about. Thank you for joining me, and thank you, Mr. Kellerman, for sharing this video. I appreciate it. All right, so we are today going to talk about the female reproductive system. Yes, last week we talked about PCOS. Thank you, Ms. Kike. I appreciate it. We talked, hi, Miss Tom, thank you for joining. We talked about PCOS yesterday, and that brought about topics from people about the reproductive system and all that. Yes, I do apologize. Sometimes I feel like, people should know this, so I don't broach it. But I'm coming to learn. One thing I'm learning about doing health talk is we may have heard of things, but we don't use it. So if you don't use it, we tend to forget it. Example is female reproductive system. I figure we all talked about, we all talk about we were taught in biology in high school, so I figured we all know, but it is understandable that we still need to broach over it, and we still need to talk about it. So that's what we're going to do today. Today is a very simple topic. It's not a heavy topic. It's just basics. All right, so the female reproductive system, what do they consist of? We have an external part and we have an internal part. We already know what the external part is. Part of the boob, the breast. Let me be all scientific. The breast, the vagina, also known as the vajayjay. We have the labia, which are the lips of the vajayjay. I call it vajayjay. I apologize. Of the vajayjay, and we have the clitoris. We have the minor and major labia. Those are the two lips that cover your vajayjay. When you ladies look at your vajayjay, you see two lips. The one inside is the minor labia minor, and the one outside is the major. So what they do is to protect the vajayjay. Good. Thank you, Mr. Shangole, for not running away. Thank you for coming. Well, the ladies in your lives, you might want to know this for them. It's expected. And also for the single guys, you might want to know this for what. So it's okay. I'm not even gonna be a prude. So anyway. So and we have inside, we have your uterus in the inside, we have the fallopian tubes, the ovaries, and the cervix inside. So I'm going to talk mostly about the inside part, okay? So we can know what things are and what they do. So first of all, I'm going to start with the vajayjay, the vagina. All right, it's a canal. I'm working on things on Health Talk. Don't worry. As I get better, I'm not technologically savvy as I would love to admit. So I'm still learning, and as soon as I learn, I'll be bringing PowerPoints, and we'll be able to see it clearly. So I'm not sure if you're going to be able to see my pictures very well. I do apologize. Actually, I do not have a picture of the vajayjay. Well, anyways, all right. So using this, all right, using as an example. Okay, so this is the inside of the female reproductive system. In proportion to the body, this is where it normally is. It's around your pubic area. So this area right there in your body is where the reproductive system is. Thank you, Miss Momi. I appreciate that. So when we start with the vagina, we do know the vagina is the one that leads outward to the body. It is a canal that joins the cervix, which is right here, with the uterus right there, cervix. So all this pathway towards the towards the outside, it's called the vagina. All right, so it's called the birth canal, and it's also known as the inward canal. That's how men deposit their stuff, so it goes up there. And also that's how we respond to the deposit by bringing out a baby. So that's part of the vagina. I'm trying to keep it as PG as possible so we can have kids watching. I'm not sure. So I'm trying to keep it as PG as possible. And I'm not sure if parents want to use this as a learning or teaching tool. So that's why I'm trying to keep it as PG as possible, as parental, as, acceptable as possible. Now we're going to talk about the uterus. All right. Uterus is right here. Also known as the womb. People call it the womb right there. All right. So not technically, the uterus is divided into two. We have the main uterus and the cervix. The cervix is called the lower part of the uterus, is lower part of the uterus. Okay. So you have the main uterus and we have the cervix, also known as the lower part of the uterus. All right. Now the uterus is where, it's also known as the womb. It's where babies develop. It has the capability to expand. It's shaped like a pear. P-E-A-R. It's shaped like a pear, like so. It's not that big when it's not in use. It's just shaped right there. However, it's been known that's what expands. That's where the baby lives in. And that's what expands. According to the size of the baby, it has that dexterity to expand. And also, it will shrink right back when it's like a rubber band. It will expand and it will shrink right back when the baby's out. All right? Okay. Now we're going to talk about the cervix. It's also like I said, it's part of the canal. It's a part of the birth canal. The cervix is where, when our men deposit, their stuff. It goes through the vagina into the cervix, into the womb and into the fallopian tube. We're going to talk about the fallopian tube later. So the cervix is also part of the external part of the body. It also opens up. It's when it's not being used, when the cervix is not being used. Oh yeah, please. That's why I'm trying to keep it as PG as possible, because I know women, moms might want their daughters watching. So ladies, daughters, if you don't understand, ask your mommy to ask me and I'll explain it to you in the way you understand. Okay, ladies? All right, cool. So now in your body, ladies, my 13-year-olds, my young ladies that are watching, in your body we have, it's this, all right? This is the female reproductive organ. For some of you, it has started developing. For some of you, it hasn't. If it hasn't developed, it's okay. Everybody has their time of developing. Some people develop later. It's there, but it's not working yet. Some people work later. Some people start working early. So if you see your friends start having periods, which we're going to talk about later, and you don't have it, don't worry about it. Your time is going to come. Trust me. Don't rush. I promise you that. All right. So let's go back to the inside. So this is what's inside of you, ladies. All right. So this right here, I'm going to bring it closer for you, ladies. It's called your uterus. That's where babies go when it's time for you to have babies. Not yet, though. When it's time for you to have babies, this is where the babies live in. All right. This is called your ovaries. All right. The ovaries, what they do is provide eggs. All right. Women have billions of eggs when you're born. You have billions of eggs just chilling inside of you. The ovary, its job every month, one side, not both sides, one side will provide the egg. And the egg will go and be chilling in the fallopian tube. All right. So the fallopian tube is a pathway. It's like an expressway from the ovary to the womb, to the uterus. Now, when the boys make their deposit, oh, congratulations! When the boys make their deposit, I'm gonna explain it to you later, young lady, about periods. We're gonna explain that. We're gonna talk about it. Okay, don't worry. I'll explain what happens to you. All right. So when the boys make the deposit and you have sperm going in and it goes past here and it goes into your fallopian tube, fertilization of the eggs of the baby making actually happens in the fallopian tube. And when the egg is fertilized, it moves to here. In the case of ectopic pregnancies, for women, what happens when you have ectopic pregnancy? Ectopic pregnancy is any pregnancy that happens outside of here. If the pregnancy is not situated here, hi Miss Julie, thank you for joining me. So Laura and me, I appreciate that. When the pregnancy is outside of here, it's called ectopic pregnancy. If your pregnancy happens here, fallopian tube, it happens a lot, a whole lot. Do not be scared that you have do not be scared that you've had ectopic pregnancy. Something no. When ectopic pregnancy happens most of the time in the fallopian tube because the eggs does not move down. It's not a problem. It's not a problem. It happens a lot. All right. Now, the only thing I'm going to say about ectopic pregnancies, if you have it, please, I beg in the name of God, go to a doctor immediately. They might have to they will probably have to take the pregnancy out because it's not supposed to be there. If it stays there for long, imagine baby is going to grow. See how tiny this thing is? It will blow it off. It will rupture it. And once it ruptures it, that's it. That's it. You can be making eggs, but you can't pass through egg. If there's no bridge, after this bridge is broken, there's no other bridge that connects over here. So in the case of ectopic pregnancy, and they tell you we need to take the baby out, I beg you, listen. I understand we want to pray and hope that it will go down. Most of the time it doesn't. All right. So when you have ectopic pregnancy, which most of the time happens in the fallopian tube around here, please take care of it instantly. All right. So now we've talked about the cervix, the lower part. We've talked about uterus, where the baby lives. We've talked about the fallopian tube, what happens there. The fertilization happens there. Any pregnancy after the womb can kill, definitely. Heard someone couldn't, because probably they waited long and the fallopian tube ruptured. If the fallopian tube ruptured, it's not like they can produce eggs, but the eggs will not pass through. Will not pass through and go there. So that's possibly what happened in that case. I'm not sure, but based on what I think happened, that's what happens. If a person after ectopic pregnancy could not have any baby, they waited too long for and the fallopian tube ruptured, and that's it. So that person, the way they can have a baby is probably through IVF. They'll have to do IVF. Okay, they'll have to withdraw the eggs, fertilize it outside, and insert it back into the womb for it to take place. So that's how that person can possibly have a baby. All right. So now we've talked about that. All right. We talked about, so that's that. Am I making sense? Do you understand what the inside, what they do? Ovaries produce the egg. Now the ovary is connected to the fallopian tube, which moves the egg into the womb. Now, if the egg is fertilized and is attached to the to the uterus, pregnancy is done and the person is pregnant. However, if there's no sperm that fertilizes the eggs in the fallopian tube, it sheds out and it becomes a period. Brings us to our next topic: periods. All right, a period, also known as menstruation, all right, or menstruation, also known as period. It's something that happens every month for every woman, except in the cases of PCOS, where these people do not ovulate. But in most cases, in most women, we have our periods every month, although we hate it. Nothing we can do about it. We have our periods every month because we ovulate every month. All right. So what happens is every month, technically, for most women, it's about 28 days. However, younger ladies can actually be longer. They can go up to 45 days. They can go, because their body still, if you're new, my young lady that's starting your period, it's still going to be weird right now. It's going to be off and on. I'm laughing because I just remembered a friend of mine, I told her I was going to make fun of her today, called me screaming yesterday, Mutiat, I need your help. I'm like, oh God, what happened? Her daughter started her period and she wanted to find a way to stop it. No. Your daughter is a woman. Welcome to womanhood. You can't stop it. I told you I was going to make fun of you today, so I am making fun of you. Welcome. Your daughter has started a period. Have a talk with her about the birds and the bees, and there's nothing you can do to stop it. Unfortunately, nothing. Anywho, so let's go back to period. So normally it goes between 28 days for us women that we know we're set in our ways, but each woman is different. Each body has, stop me with what not. What? I didn't get, I'm sorry, Miss Karima, I didn't get that I didn't get that comment. So each woman normally runs for 28 days. Every body is different though. Every single body is different. I could be 28 days and my sister could be 30 days and somebody else could be 31 days. You have to calculate. You have to calculate how your period goes. Especially if you're trying to get pregnant, you want to know how many days your cycle runs, because that would determine when you ovulate. Now, if you come by me, I tell you on day 14 I ovulate, because probably my period is 28 days long or 29 days long. Now, technically, there's no day 14 for everybody. Stop getting my mistake. There's no day 14 for everybody. Everybody's ovulation day is different based on your period. So this is what happens in the period before a woman has a menstruation. Every month we have the system going in our body. Every month it's divided into it's divided into 3 phases. Yes, we have the follicular phase, follicles. I know accents, I apologize. Follicular phase. We have the ovulatory phase, and we have the luteal phase. Now those are 3 phases that constantly happen in your body as every month. There's nothing you can do about it. Suck it up. We have no choice, women. All right. So now, this is what happened. In the follicular phase, all right, let's say your period, I'm going to use February because February has 28 days, all right? So to help you understand how we calculate this. All right, so day 1 is the first day you get your period. So if you get your period, your first day of your period is February 1. Expect another period March 1. because that's 28 days long. That's why I'm using February as an example, because that's just 28 days. And 28 days is more common. But if your period is 30 days long, do not even, don't stress yourself. If your period is 35 days long, that is you. I mean, if your cycle is 35 days long, that is your body. Because there are some people that have the period for 3 days, and some people have period for 5 days. Some people have periods for 7 days. Each body is different. What happens to me will not happen to you, may not happen to your sister. You know, even if you're twins, sometimes you don't have the same, but you do sync. But sometimes it doesn't happen. All right. So this is it. So day number 1 is the start of your period. All right. So that's when the follicular stage happens. All right. During this day, sorry, it's very technical, so I have to keep reading in my own head too. All right. 2 hormones are released into your body. We call them the FSH. If you go to a GYN, you hear this word a lot. And FSH and LH. FSH, LA. Follicular stimulating hormones and luteinizing hormones. Those 2 hormones are released into your body. Now, these hormones tell your ovaries, oh yeah, okay, I have a question. I'm watching with my daughter. She's still waiting for her, but complains of abdominal pain a lot. You want to check that out. If she's complaining of abdominal pain, how often is the abdominal pain? When does it happen? How often does it happen? There's so many things to talk about to know what's going on. So I would want to check that out with your daughter. You want to take her to a gynecologist if she's around that age. Her body may be getting ready. So but just want to check it out, make sure there's no other issues that's causing the abdominal pain, the stomach pain. I have a question. I did period in January, and up to now I haven't seen it. What could be the cause? Unfortunately, I can't tell you because I do not know you. I have to see you or treat you in person and talk to you in person and do tests to tell you. I cannot tell you what the cause is. What I can advise you is to go visit a primary doctor or a gynecologist to figure out what's going on. We are in March, so either you're pregnant, the differential diagnosis of either you're pregnant, either you're, let's say, pregnant is the most important thing. For absence of period is pregnancy. So either that, or if you're always regular and you stop all of a sudden, something is going on. You want to go to a doctor and figure that out. That's my advice for you. All right. So those hormones, the FSH and the LH, they trigger the ovaries to start producing follicles. Remember, it's called follicle stimulating hormone. All right. So it stimulates. It tells your ovaries, oh yeah, it's time. Start stimulating follicles. All right, and the ovaries start. Remember, we're born with millions and millions of eggs, millions and millions of eggs. So all of them starts running. It's my turn. So the ovary is doing its work. All of a sudden, all right, the ovary will give about 15 to 20 eggs at one time. Okay, and now the FSH and the LH will now trigger estrogen. All right, and as it will trigger estrogen to help with development. What causes thick blood in? Please rewrite that question. I don't understand. Maybe you mean thick blood in menstruation. Blood is thick. Blood is not thin. Blood is thick. I advise ladies. I'm not sure if you get this. When you have your period, look at your blood. Don't be disgusted. You need to look at the blood you're putting out, because if something is different, how would you know when you don't know what your normal is? The purpose of this health talk is to understand your body, so you can know what you. Don't be disgusted. If you poop, do you look at your poop? Like if you go to the bathroom and poop, do you look at it? You don't. If you don't, start today. Because people that have colon cancer, one of the quickest way they see is like, my stool is different. Yes, every single function, every single part of your body, everything that your body does has a reason. So you might be like, ew, I don't want to look at my own poop. Auntie, uncle, please look at your poop. It's quite important. Because some people, that's how they know that something is wrong. Because they're like, this poop that's normally big like that, thick like blood clot. The blood clot is the egg that's breaking down. The clot is the egg that's breaking down. That's it. There's some part of your period that will be light, and some part of it will be thick. When you're in heavy flow, when your lining is shedding, I will explain it to you as I go on. All right? Part of your period will be thick, and part of your period will be thin. Look at your period, ladies. Look at the blood. Look at the consistency of what's coming out of you, so you can know that, okay, this is my normal. Now, if something changes, you want to be your doctor cannot know everything. You want to be the first one to bring your doctor's attention, like, doc, excuse me, sir, I have a question. last month my period was yellow in color. Today is blue. What is going on? You want to tell your doctor, and your doctor will be like, okay, this is why. But if you don't know what is wrong with your body, if you don't know what your baseline is, how would you know if something is wrong? So everything your body brings out, I don't care what it is, look at it. If you pee, look at your pee. Is it yellow? Is it light yellow? Is it dark yellow? Okay, we talked about that in kidneys. There's every color of urine, there's a reason for it. Go back and watch the kidney video. All right. I'm having pain in the right side, of burning sensation, sometimes mild, comes in an hour, but once I take medication, it stops. Maybe, I'm not sure. Again, I can't tell you what it is from one conversation. It's not, my head is thinking, if the doctor couldn't find anything, then pretty much there's nothing. If there's nothing, there's nothing. It's just your body, like I explained. Every single body is different. You want to check how long. You want to sit down and count how long your period lasts. So to you, it might feel like it's longer, but your body is like, no, I'm not even up to 30 days yet. So double check. Now, with the pain, abdominal pain, when it comes to pain, I always say go to a doctor. They need to see you in person to diagnose what's going on. Unfortunately, I don't diagnose and I don't treat online. My advice, which is what I'll keep telling you, is to go and see a doctor. Go see a primary care, go see a GYN. If you're having pain on one side of your stomach once a month, it means you're ovulating. Most likely it's you're ovulating. And yes, some people's ovulation, including mine, I have to take pain medicine for, because that pain is serious. So some people, when you have, it's one side doesn't include burning or anything like that. It's just cramping. Some people's ovulations is that bad, is that painful. So you take a pain medication and may make you feel better. I do, for me. Anyways, so we're gonna go back to, we talked about the follicular phase. Let's go. All right, as estrogen rises. Okay. I'm sorry, I'm trying to find where I was. All right, so like we talked about FSH and increases estrogen. Now, as estrogen rises, it gets to a point that, when there's enough eggs out there and your estrogen is rising, estrogen will be like, okay, I think we have had enough eggs for this month. Oh yeah, brain shuts the FSH off, and your brain will not shut that off. Now, estrogen takes over. Now, estrogen is waiting, like, okay, as we go now, let us be growing this. So there's 15 eggs. Let's see which one will carry. So estrogen works with the ovary, and they'll produce one solid egg. All right. So as that solid egg, we're still in the follicular phase. So follicular is when everything is building. We have that one egg that we're going to release that month is building. So estrogen is working with your ovaries to bring one solid egg out. Remember, the FSH just triggered your body and it's giving like 15 to 20 little eggs. But the estrogen works with the ovaries and you bring one solid egg out. So once that's done, one dominant, the big one, comes out, and everybody else pretty much goes away. It gets absorbed back by the body, and then that's it. One egg removes. During the ovulatory phase, that egg, you remember that big one that beat everybody out, like it's my turn, say, that one comes out. All of your ovaries gets released by one side of your ovary. You have two ovaries, one on the left and one on the right. All right, one on the left. So each body is different. Somebody will alternate left and right. One body, maybe the left one is more prominent, or the right one is more prominent. That will give more eggs. But one side of your body will give you one egg, not two. One egg every month in the ovulatory period. During the ovulatory period, estrogen is still rising. Like, okay, I'm ready. Bring it. Where's that border? Come and handle this business. Estrogen is waiting with that egg, ready to be fertilized. So it's chilling. It's released by the ovaries, chilling in the fallopian tube, waiting like, where's this uncle? We're waiting, So now at that point in time, sorry, all right. At that point in time, the luteinizing hormone and the estrogen, they've released the egg. Egg is now in the fallopian tube waiting. Now, in the luteal phase of the period, now egg is rolling, slowly rolling into the uterus. There's no bother to fertilize. But now, while the ovary was getting ready for the egg, was getting ready to release the egg. The luteinizing hormone is doing what? It's preparing the womb. Now the womb is, there's my little picture. See how thin it is. The skin outside, see, the skin inside the womb is normally just thin. When there's nothing in there, it's thin. But when when you're starting to ovulate, it becomes more mucousy. So it can adapt and trap the sperm and hold the egg when it comes in. So it's more mucousy. It's ready. It's ready. All this is ready, and blood is like, ready to go, because they're ready to attach. When that and mistakenly jamming, the egg is like or the womb is like ready to hold on. All right. Oh, thank you. And the womb is ready to hold on. So all that is going on in the stomach, in the womb. So let's say the egg now rolls in. There's nothing that happened. Nothing. We are on a strike that week, that month. Chai, your uterus is like, okay, I've waited, and this normally happens between period of let's say the last week of your period, of your cycle. All right. So I'm sorry, follicular stage is normally from day 1 to day 7 or day 8, depending on who you are, or depending if your cycle is longer, it lasts longer. And then ovulation is actually a longer period of time, because it's longer, and they normally say 14, from day 10 to about day like 16, 17 of your period. So if we're using February, we can say follicular hormone starts, follicular time starts from February 1 to about February 7 or February 8. And then ovulation time starts. Now, ovulation gongo itself may not happen on February 9, 10, 11. It may not. See, all that time, remember, your body doesn't do everything, drop one to. No, your body takes its time watching what happened. And it takes a while for the eggs to reach. Now, if the ovulation time, remember, sperm actually stays alive in the body for 3 to 5 days. Those suckers are mean. Damn! 3 to 5 days, sperm is chilling there. The sperm can be chilling like, what's up? So if you have sex on day 1 of your ovulatory phase, or day 20 of your ovulatory phase, once that egg jams that sperm can be chilling there, living there for 5 good days. Nothing will do it. All right. So once that happens, that's when conception happens. All right. Am I making sense? Are you understanding me? Sperm stays in the body for 3 to 5 days. So if you have sex on Monday, the last sperm of that Monday one will not come out for Friday. Have sex on Tuesday, the last sperm of that Tuesday one may not come out for Saturday. So see, you have options. They are staying in there. 3 to 5 days, sperm will stay in there. All right. So luteal phase. Let's say there's no sperm. So what happens is everything, progesterone rises. So everything will start to shed. The inside of the lining of your uterus starts to shed, and the egg also will start to die. That's what happens when you have a period. Your period is the lining of your uterus shedding. That's blood. It is thick. It is dark. The clots you see are part of the lining and also the egg. I know it's gross. I know I'm disgusting. I know this. But next time you see a clot, take it out of your pad and look at it. Look. Know what it is. Know what it feels like. See a clot, pull it. See what it looks like. It's part of your body. It is part of your body. Don't be scared of your own body. Don't be disgusted by your body. This is your body. If you do not know what the normal looks like, how would you know what the abnormal looks like? So, the blood is thick. The blood is dark. Right? And it's clotty and it's painful. When you're passing a clot, a big lining that's going through your vajayjay. Don't watch me. Don't watch me, Miss Omomi. Do not even watch me. Pull it out and look at it. Yes, it is part of your body. Don't be disgusted about your body. I beg. It's your body. Learn it. Know it. Know it. Know what the normal looks like. All right? So, I'm hoping we understand period. My young ladies, my 13-year-olds, please, if you have any questions, ask mommy. All right? You and I can talk on the level. Don't worry. All right? Cool. All right. So, like I said, people ask me, how many eggs does a woman have? Billions. But every month they die. Every month they die. Unfortunately, beyond circumstances. Wow, this is a long talk. So, Now, some people, I had a discussion someplace that somebody was like, when I wear my pants, I have no discharges. I am a clean woman. Someone has been lying to you. Someone has been lying to you. Okay? As a woman, you're supposed to have discharges. Oh, thank you, sweetie. Yeah, we'll talk if you have any questions. Okay? Have mommy contact me. We'll talk. All right? As a woman, you're supposed to have discharges. It is part of your body. It is your body. When you take off your underwear and you see a mucus, no teeth. Like, okay, today is yellow. Okay. Tomorrow it may not be yellow. It doesn't mean that's a big lie. Abio. Tomorrow it may not be yellow, it may be clear white. No teeth. Every discharge that comes out of your body, it means something in the menstrual cycle. Everything that comes out of your body, you have discharges. Ovulation stays how long, please? About 10 to 14 days, depending on the human being. All right. So every discharge that comes out of your body, there's a reason for it. All right. So let's talk about discharges. I discharge yes, please. It's part of your human self. Anybody that tells you I don't have discharges, I am so clean, my body is so clean, go and check yourself out. Something's wrong with your body. You should have a discharge. Anywho, so right after your period, there's nothing, because you just let go. So most people are like, there's a really good app called Clue. I'm sure. No, I haven't. We use My Days in the United States. So if you're in the UK, I'm told there's an app called Clue. I'll look into that. I haven't heard about Clue. Oh, I'll look into it. What is it? Ovulation or period calculator? My Days is both an ovulation calculator and a period calculator. So, if anyone wants that one. All right. So, during the period immediately after your period, you probably have no discharges because you just shed a lot of blood. Your body too is like, please, I beg, I can't do right now. All right. So, as your ovulation begins, now your cervix. Remember, I told you your uterus is thickening up, ready to attack anybody that come in. Like, you are not going anywhere today. So that discharges. You're going to get it in your underwear. That mucusy discharge is going to come. As ovulation begins, you're going to start seeing mucus. It's going to be, I think, white. It's like cream. Yeah, it's like cream as ovulation is coming. Now, when you're ovulating, it changes color. It becomes, I know I'm going to ruin this for you. I'm sorry. You know when you crack egg, the white part of that egg. I know I've ruined it for you. Sorry. I am that evil. Anyway, we crack egg. The egg whites. That part, that thickness, see how it thick it is. It's what it becomes when you're ovulating. All right. So at that time, it's more thicker, it's clearer. All right. And after ovulation, it begins to dry again. So right after your period, you're dry. As you begin to ovulate, it becomes mucousy. It's not as thick. It's thin and mucousy. You know what mucus looks like now? It's like egg. It's like brioche. No, not brioche. I don't want to kill that for you. It's like cottage cheese, like ogi almost. It's like ogi color. I know. I'm sorry. It's like ogi, not ogi consistency, like ogi color, like that kind of white. And then as your ovulation goes more, as you're actually ovulating, gong, it changes into egg white color. And after ovulation is over, it goes back to dry. So take note, ladies. Know your body. This is very, very important. It's not when we are trying to give birth, that's when we start running up and down. We have daughters. Let them know what's going on in their body. Don't be scared to teach them what's going on in their body. Back in the days, they didn't tell us. It's like, if you get pregnant, I push you out of my house, you can't sell pepper. That's what my mother told me. Yes, mommy, you told me that. But let's talk to our daughters. Let them understand. Let's understand how to calculate their periods. Let them know that whatever they're feeling, it's not weird. If you don't get your period, I was the last one to get my period in the house. Everybody else got their period, but Mutiat. I was like, what now? Why is it only me? I was the last person. I graduated high school before I got my period. Yes, I know. I was the last one to get period. So, young ladies, if you're the last one amongst your friends to get period, please enjoy it. Trust me, period is nothing. It's not easy. Every month of you getting drained and you're like, And ladies, young ladies, when you're having your period, you get tired. It's expected. If you're tired, it's expected. Just let your mommy know that, mommy, I'm tired. Don't feel anything is wrong. It's expected for you to be tired because you're pulling out blood, a lot of blood. And blood is what feeds your body energy. If that's draining out of you, you're going to feel a little tired. Let mommy know, mommy, I'm feeling tired. Mommy, I have pain. My stomach hurts. And mommies, listen to them. Because you didn't have abdominal pain when you're having period, doesn't mean your daughter's not going to have it. Each body is different. I thought I was going to have 3 days like everybody else. Is a lie. I didn't. I was the weird one in my family. Is a lie. So just because you have 3 days doesn't mean your daughter's going to have 3 days. Your daughter may end up with 5 days or 7 days of period. Just because you have 7 days doesn't mean your daughter only having 3 days and something is weird. No. Each single body is different. Every single woman is different. The way your body works is different. So mommies, please listen to your little daughters when they say, mommy, my stomach hurts. Listen to them. Mommy, I am tired. Listen to them. Have them talk to you how they feel about their period so you know what is normal for them. They may not understand what's going on in their body at this point, but you're their mom. You're supposed to understand. So when something is wrong, when you notice, this young girl has not had a period in 2 months, don't automatically think pregnancy. Think what's going on. If she's skinny, it might take a little while for it to regulate. All right? She might have it this month, it may not have it for a little while. If you're skinny, it takes a little while for your body to regulate. If you're obese, also, it takes a little. People have 10 days. Is their body. Unfortunately, is their body. Thank God it's not me, is all I can say. There are some people that have it that long. I feel bad for them. But I thank God it's not me. God forgive me. Yes, it is possible. Some people go long. But it's not going to be heavy for those 10 days. It's going to be maybe first 3 days of heavy and then light. That's how they are, unfortunately. God forgive me. Thank you, God, it's not me. All right. So if we have any questions, please send me an email at nursemotiat.com. Miss Omaomi, if our little lady has a question, please contact me on Facebook. We can FaceTime and I can explain to her better. All right. So thank you, lady. 10 days. Some people are blessed like that. Thank God I'm not that blessed. Thank you. All right. Anyways, thank you so much. I did have fun having this discussion with you. Next week, I don't know what the topic is going to be, but if you have any topics that you want to talk about, let me know. I think March is Women's Month, so I want to stay twice a month. Some way people are like that. If the month is long, remember, if your period is 28 days, if the day is 31, let's say I use February as an example because it's 28 days. Remember, in March, days are September, April, June, and November. The rest are 31, except February, 30. March is 31 days. All right? So if your period is 28 days, you're going to have a period twice in 1 month. Twice in 1 month. If you're regular, if your period is 28 days, if you're regular to the T of 28 days, if you have a period on the 1st, you're going to have a period on the 29th. So that's twice in 1 month. So it's possible. All right. So if you have any questions, please email me at nursemotiat@gmail.com. It's been a pleasure teaching. It's been a pleasure being here. Ask me questions as you see fit. Share this video. We never know where it's going to end up. You never know what young girls getting confused of. What's wrong with my body? Why am I not feeling this way? Why am I not doing this way? Talk to me. Share the video. Talk to them. Teach them. All right. Don't let our young ladies be scared of what's going on in our bodies. All right. Thank you very much. God bless you. It's been fun. Motiat Sunshine, signing out.